Good morning, everyone. Dr. Christine Smith here, back for another Instagram live interview with some of my awesome doctors that I love to talk to. So today we're going to be talking about regenerative medicine with Dr. Georgiana Quinn. She is a board-certified doctor in physical medicine, rehabilitation, and has specialty training in regenerative medicine, functional medicine, anti-aging medicine, and medical aesthetics. Pretty freaking cool. So the reason that I wanted to do something on regenerative medicine is because I think a lot of people don't even know that it exists. And it was something that completely changed my life. I basically had a terrible wrist injury and a terrible knee injury within like a couple months of each other. And I went from being a super active person that like skis double blacks and bikes and runs and hikes and does all this stuff and teaching yoga to not being able to go down the stairs. And there is a huge identity crisis that kind of goes with that I don't think a lot of people really talk about in the world of injury. And when you go from doing all those things to not being able to do anything that makes you feel like yourself, it's a very confusing time. And it's really scary, and our conventional system, that's what most people go to, usually pretty quickly will direct you to surgery for something like that. And that's what happened to me. I went to like 10 different doctors, and I had them all tell me that I had to like basically reconstruct my knee in my early 30s. And I just didn't want to do that because that seemed really drastic so early in my life, and I knew there was other stuff, and that's only because of the field that I'm in. So I want to get this out there and tell people that this exists. So like if you're injured, you know that this is an option. So I am going to invite Dr. Quinn here, and she will hopefully hop on quickly. There she is, on any second. But basically, yeah, this totally changed my life. I went through a couple series. There she is. I went through a couple series of regenerative injections on my knee as well as my wrist, and I am back to skiing double blacks and have my life back. And it was just I'm so grateful that I found it. So that's why I wanted to talk to Dr. Quinn today, because this is what she does all day for a living, and she works with like high performance athletes, CEOs, lawyers, all that kind of stuff, just to get all these high performing people back to their lives and back to feeling like themselves, and just back. So anyway, hi, Dr. Quinn. Good morning. How are you?
Great. How are you?
I'm good. Thank you. So let's just start with the basic question. What the heck is regenerative medicine? I think a lot of people don't even know that this exists.
That's true. People don't know it exists. And so regenerative medicine is actually a huge umbrella for a lot of things, and probably even different physicians classify it differently. So just really briefly, I mean, regenerative medicine is any part of medicine that helps to regenerate and heal and make the body more youthful. However, what we're going to be talking about today is specifically regenerative medicine using your body's own cells to prevent the need for orthopedic surgery. But there is even, you could use stem cells and platelets for aesthetics, or stem cells and platelets for hair loss and for cardiac conditions and things that I don't do. But also the umbrella of regenerative medicine can include medications and things like that. So just to clarify, we are talking about a very, initially regenerative medicine came out as, I think, just the use with stem cells essentially, but it's kind of expanded so other people use it maybe without talking about stem cells and things like that. But
totally.
So, yeah.
I love it. So I just want to give people like a little bit of a baseline of like the different kinds of treatments that we're talking about. And I'll just talk about my own experience, and then you can kind of speak to these things. So there's kind of like different levels of intensity that you can go with depending on what's going on. So one of the baseline ones is called prolotherapy, and I'll let Dr. Quinn talk a little bit more about like what is included in that, but it basically kind of stimulates inflammation in the body to basically ask the body like, hey, come heal here. So it like stimulates all the right signals for the body, like come heal a specific area. And then there's something called PRP, which stands for platelet-rich plasma. And that's basically where they draw your own blood from your body, they spin it down and so that they just get the plasma, and then they inject the plasma into the injured ligament or cartilage or whatever. And then that basically provides all the building blocks. So we've done the like signal of, hey, come heal here. And then we've provided all the building blocks for the body to do that, as well as some other signals of, hey, come heal here, and here's all the materials. And then the next level up would be kind of the stem cells. And there's different kinds of stem cells, which I'll let Dr. Quinn speak to. For myself, what they did is they ended up using my own. So they took them from my pelvis. They took a big needle, went into my bone marrow of my pelvis, pulled out some of my stem cells, spun them down, and then injected them into my area. So what happened to me, just so you can get a feel of just how powerful this is. So I had that wrist injury. It was like a ligament injury. I just kind of was hoping it would heal, but it was really struggling and just not the same. I couldn't rock climb anymore. I couldn't hang from anything. Like I couldn't lift stuff. And also I'm a chiropractor, right? Like I use my hands all day. It's kind of detrimental for my job. And then with my knee, I was just teaching a yoga class, but there's this whole like inflammatory cascade that happens, and I'll speak to that later. But it's like I injured my wrist. I was in a really stressful time in school. I was an idiot and didn't stop and like kept working and kept doing all this stuff and just didn't give my body time to heal. And plus the stress. And then so like 3 months after my wrist injury, I was working and teaching a yoga class on my fist because, you know, I couldn't do this. So here I am working injured like a dum-dum. And then basically was in a low lunge and dislocated my kneecap while I was teaching the class. And then went into shock and finished teaching the class and mixed class because we didn't have a sub. So here I was continuing to teach while double injured, very dumb. And I think that's how I just ended up messing myself up so much. And my knee was getting better. And then I went hiking and it redislocated. Actually, not even during the hike. I was like back to hiking and doing stuff and I was getting there and I'd done some PT, but it was, you know, just kind of basic PT. I'll talk about the more advanced PT you can do with injuries. But then I was going down 3 steps and it went clunk, clunk and redislocated. And then when I finally got an MRI, what had happened is I had folded up a piece of my cartilage underneath my kneecap and taken out a chunk of bone that was about a centimeter squared in size. And it was like super painful to do pretty much anything except basic walking. Like I couldn't even stomp snow off my boots in winter. Like that was horribly painful. I couldn't go down the stairs.
You did that the second time, like the cartilage detachment, or
I have no idea like exactly how it happened, but I'm guessing that's probably what happened. But then that's when I started going doctor shopping, right? And I think people forget you can go doctor shopping just like you go shopping for a plumber or an electrician or anything. Like you want to go find the best doctor. And that's why I'm talking to Dr. Quinn today, is because she's one of those. So there's lots of people that do this, but I like the ones that are really, really good at it. And so then to heal mine, we ended up doing 3 rounds of stuff. So we did PRP and Prolo the first time, and then 2 months later, we did some PRP, and then basically they drilled through my kneecap to inject the stem cells into the bone lesion, which then allowed the bone to regrow from underneath and regrow the cartilage. And then all the damaged cartilage flaked off and my body took care of it. And then we followed up with another PRP and Prolo. And at that time I got 1 singular injection of PRP into my wrist. And a year later, I got a follow-up MRI and my cartilage in my knee had pretty much totally regrown. There's just like a little bit of swelling left in the bone. So the bone was still healing, but it was like healed and it was gone. And it just was normal again. And I got 1 injection in my wrist and I'm rock climbing again and I can work with like no trouble. And this just blew my mind and I grew this whole new love for it. So I'll let Dr. Quinn kind of talk about those.
That's the amazing thing is, I mean, people don't know about it. And I think it should, I mean, I would love if it became more of a part of regular, you know, like medicine or a regular workup, because the thing is, you know, so many people jump to surgery and surgery is always an option. And I always tell people the best possible outcome you can have after surgery is to say, I wish I would have done it sooner. Because once you go to surgery, like you can't go back, right? So starting with the least invasive, the least kind of detrimental to the body, and then working up from there. And so, yes, like maybe maybe sometimes you do need surgery, and if patients come here, and if like it's a surgical case, I will absolutely send them to surgery. But with regenerative medicine, worst case scenario is it doesn't work, and there's still surgery as an option. But once you have surgery, and I see post-op patients, you know, all the time, and we can do regenerative medicine, and we do, depending on the case. but, you know, they've already had surgery. And so if something happens during surgery, you know, even that surgeons would consider a fine outcome, but just like it's not quite right. And let's be honest, nothing's ever quite exactly normal after surgery. I mean, I had my ACL replaced over 25 years ago, and it's great. I wouldn't be doing what I'm doing, but I definitely have arthritis in that knee, and it hurts, and it's tighter than the other side, and a bunch of things. No complaints. I'm very happy and grateful for my surgeon. But, you know, if there was regenerative medicine back in the day, who knows, maybe it could have been fixed with that, and then I wouldn't have like the arthritis. And then obviously with surgery, there's always risk of anesthesia, you know, side effects, the surgery not working, and now you've taken out bone or put screws in or have a knee replacement or whatever, and you can't take that out if it goes wrong. And so that's what I think people need to realize is once you have surgery, you can't go back.
I like it as a last resort.
It should always be a last resort. And so with regenerative medicine, I mean, the beautiful thing is, in my opinion, so many things about it. Like, I love that, you know, it's other than prolotherapy, or, you know, we're using your body's own natural healing abilities. Like, our bodies are these amazing structures of physiology and neurochemistry, and our bodies want to be in a state of homeostasis and healthy. And so with regenerative medicine, we are just like encouraging it and forcing it to use its own innate knowledge to heal itself. And that's just, to me, so cool. Prolotherapy, we are injecting a solution that's not, that does not exist inside your body, but it's sugar solution. So, I mean, I've only ever seen one person have like an allergy to the actual medication we're injecting, which would be the really only risk with prolotherapy. So, kind of just to go back for people who just joined, the difference. So prolotherapy is the original regenerative medicine. It's been around for a century. It's been around forever. And it really is injecting a sugar solution into injured tendons and ligaments to stimulate a healing cascade. And the healing cascade starts with like a noxious substance or an injury, and then there's this whole flow of cascade that happens in your body. And your blood vessels inside of your body are essentially the highways to healing. So they transport blood into places where you need to be healed. And so when you're injured, there is the platelets actually stimulate growth factors and cytokines. And I call platelets the general contractors of the injured area, because they're kind of calling out and getting people or getting cells to come heal the area. So prolotherapy is kind of like what Dr. Christine said, like one step above that, in that it's not bringing in the platelets and it's not bringing in the general contractor, but it's causing damage to the area so that your body sends blood to that area. Now, part of the problem with you know, joints and tendons and ligaments is they innately have a poor blood supply. And so prolotherapy works, but not as good as PRP and stem cells, because PRP and stem cells are taking that super powerful blood supply and putting it into an area that doesn't have a good blood supply. So that's kind of part of the reason you don't heal as well. And so essentially with PRP and stem cells, you're forcing a blood supply to an area that doesn't have it, and a really potent one at that. We take a lot of blood and we concentrate it down to maybe the size of like your index finger, and then we inject it into your injured areas. And so that stimulates growth and healing, and it's not an overnight fix, but it's pretty powerful. And then, you know, the difference between PRP and stem cells, like I said, I call PRP kind of the general contractors of the area, and stem cells are the worker bees. Like, you're just taking a ton of stem cells and the workers and sticking them into the area and forcing them to do the repair and the healing, as opposed to calling them from a distance. So that's my interpretation of
Perfect. No, I love it. And then I think a lot of people are like, oh my God, but this is like crazy expensive. Like, how can I do this? Honestly, you know, it's like this, a lot of this isn't covered by insurance. Some of them are starting to hop on more and more, but most of the time it's not. I ended up paying for it out of pocket. Totally worth it. It ended up overall being less than my surgery would have cost with insurance.
Well, that's the thing that people don't realize. Yes, it's, I mean, depending on who you go to and where you go, it's typically between $5,000 and $10,000. If you find someone doing it for $2,000, I would run, because I don't even know how that's, literally, my costs are thousands of dollars. You know, I don't honestly know how that's possible. But it's typically between $5,000 and $10,000, depending on the area and where you go.
And she's talking about stem cells. Like, if you just decide
Correct.
to do like a Prolo or a PRP, it can be much less than that.
Absolutely.
And you don't have to do stem cells. Mine was pretty severe. Like, I had a chunk of bone damage and like a lot of the cartilage damage. If you like just have a ligament thing, it can be like, PRP can be really effective, or like a torn rotator cuff. It's great for that. Totally. So yeah, let's will you tell us about like what kind of injuries that this can work for and like what you tend to treat?
I mean, so again, talking in the orthopedic space, I mean, so arthritis, typically, if your arthritis is severe, I'm recommending, so the things that I definitely recommend stem cells over platelets for is severe arthritis and labral tears. So labral tears in your shoulder or labral tears in your hip, I just think stem cells are, for some reason, I mean, stem cells are always more effective, but obviously not like cost effective. But going back to the cost real quick, yes, PRP is typically between, depending on where you go, $500 to $1,500 per injection. The cost of surgery, though, even though it's covered by insurance, you're paying like an anesthesiologist, your surgeon, the OR, you're paying all of these things. Then you're taking time off of work, so whatever that is to you financially. Then you're going to physical therapy, you know, so you're paying for braces, you're paying for all of the, like your hospital stay, all these things. So yes, it's covered by insurance, but it ends up, like you said, I mean, being more expensive than these procedures. And again, you can't go back after you've had surgery. And so that's what, you know, people don't realize. And there is a cost to, I mean, I see the average person and I see professional athletes and, you know, they literally can't afford to miss days of work, right? And so for stem cells, which is the most invasive, you're in and out of my office in 3-ish hours. And typically you can drive yourself home and, you know, you might be sore the next day, but you're not like debilitated.
Let me give you guys a realistic view from my experience of like what my recovery time was like. So with the prolotherapy and PRP, when like, and I actually met Dr. Quinn after I had my treatment done, so I had it done somewhere different. But I think there's so many people out there doing it, and like I said, there's just like very specific people that I think are doing it particularly well, which is why I wanted to speak with her. And but the ones that did mine, I feel like they did it well too. But the PRP and Prolo, I think. You know, they basically told me to like not do stuff for like a week.
Yeah.
And with my job, I have a different job, right? Like I'm not just sitting working at a computer. If I had like a computer job, I could have probably been doing stuff like the next day. With my job, since it's like a super physical job and I'm forcefully using my hands, you know, I was trying to be pretty gentle with it. And I was able to go back and be doing stuff after like a week or so. And then I was able to do stuff more heavily after like a month or so. With the stem cell thing where he drilled a hole through my kneecap, that's a little more intense too. He's basically like, yeah, just stay on crutches for like 2 weeks. And I was on crutches for a week. And then I was able, he was basically like, stay on crutches until you can walk normally because we don't want to imprint bad neurology into the muscles. And I'll touch on PT later of like why PT is so important for your recovery. And I'm sure that's why I recovered as well as I did, is because of the particular kind of PT I did and the one that I worked with. But basically after a week I was back walking, and then I was able to practice. And like, if you've been to a chiropractor, you know it's a very physical practice, and I was able to practice after like a couple weeks. I just had to be careful with my body and gentle with my body, but I was able to go back to like a super physical job within like a week or two after all of these treatments, which is insane because you think about, you know, surgical recovery, and that could be months, because with surgery it's like you are healing a certain area, but you're also damaging a ton of other tissues. With the regenerative medicine,
when I've had surgery, it takes me 2 weeks mentally to recover from the anesthesia. And, you know, even when I was out of training, it's like, oh, you're recovered like within a few hours. But I mean, mentally, it totally, you notice it. Like you're just not normal for a couple weeks.
And
so if you have, for me, like I have a highly intellectual job, like that is difficult to go back to.
Yes. And I have another friend right now, and she had to go under anesthesia for, you know, she broke her bone severely and they had to put like a plate in. So that's different, right? That's when surgery is a godsend and it's really helpful.
Yes.
But the anesthesia has been messing with her brain, and it's like months later. So I didn't have to go under anesthesia at all for any of this. Even when he did the pull for the bone marrow in my pelvis, they basically gave me like a really low epidural just for that area. And then everything else was just local anesthetic, and that was it. Yeah. And my brain was fine, and I never had those problems. I never had the memory problems that come with that. So it's a blessing, really.
Yeah. And so, you know, just touching on, because you had bone marrow stem cells, so there's many different types of stem cells.
Yeah, let's talk about the types of stem cells, because this is confusing.
It is confusing, and it's something I'm really passionate about. And I mean, I think one of the reasons why Dr. Christine, you know, says I'm one of the best, I've been doing it before a lot of people have been doing it. So back in the day, there's something called umbilical cells these days, and they serve a purpose, but they did not exist like even 7-8 years ago. So pre-umbilical cells, you had to be well-trained in regenerative medicine to do it. And there's a few things that, in my opinion, make you well-trained. One of them is that you're a good injector. So you need to have a lot of injections under your belt, period. So that's typically like a rehab doc, sports medicine doc. Even some orthos aren't that good at it just because they do surgery. They're not actually trained. They can do injections, but they're not trained to do a ton of injections. And
will you touch on how you do like imaging with all this too?
Yeah, so that's exactly what I'm saying. So you need to do guidance. So there's two types of imaging. You can use an ultrasound, or you can use what's called a fluoroscopy, which is a live x-ray. So depending on where you're injecting, you would use one versus the other. There is an overlap when you can use both, but ultrasound is going to see soft tissue, and the live x-ray is going to see bones. And so you really need the live x-ray or the fluoroscope if you're going to do spinal injections. I use an ultrasound for some soft tissue spinal injections, or I can see facet joints, but like there's no way I could get into the epidural space with just an ultrasound. You can do like joint injections with either ultrasound or fluoroscopy, but you really want to be seeing someone who's doing a guided injection so they know that they're in the right space. There's no reason that anybody should be doing regenerative medicine that isn't using some sort of guidance. Because again, they're probably not well trained. That's just, I mean, this day and age, if they're not using guidance, they're old school and they've, elected in. I mean, I learned injections back in the day pre-guidance, and yes, I can do a knee injection, a shoulder injection. I could do injections without guidance, but what's the point? And especially since this is not covered by insurance and it's cash-based, we want the best outcome for our patients. So
they do it once.
You do it once. And things that help us know if we have a good outcome, right? There's always people who might not respond to a perfect treatment, but you want someone who's well trained, because that way you know that, that it wasn't their skill that, was the problem, right? So, when I see patients, and if they, I mean, most of the time, honestly, like 80-90% of the time, people are doing very well with regenerative medicine. But if someone, says that that they're not any better, didn't have a good outcome, I can look at my notes and it say like I was directly into the joint. It was visualized, so I know that my concentrations of my cells were good and that my injection was good. And so maybe they're just not, going to respond, or maybe they need a different treatment, or, we have that conversation. But I have seen a lot of people who are like, oh, I had stem cells and it didn't work. And in my mind, it's always like, who injected? Were they well trained? Did they use guidance? What type of cells did they use? So again, it's important. For example, you go get a knee replacement. You know that orthopedic surgeon, now obviously there's good and bad doctors of all of it, but that orthopedic surgeon, before they ever were trained in knee replacements, had to go to medical school, had to learn about all of the anatomy, and then probably had to do, I have no idea, 50 to 100 in training before they're allowed to do it on their own. So if you didn't have a good outcome from your knee replacement, it's not because they weren't trained well. And this is where regenerative medicine gets in a huge gray zone, because there's not a standard of treatment. And so any Joe Schmo can pick up a needle and do regenerative medicine, and we just don't know what their training is. So I would say, this really should be being done by a physician. It should be with ultrasound guidance. And then you want to know, at least that they know, if they're doing PRP, that they know what their platelet counts are. That's a big deal. There's some people who do single spin and you're just not getting the right concentration of platelets. For stem cells, I'm very, particular. Like, if your provider, whoever they are, only offers you purchased stem cells, so umbilical stem cells or amniotic or Wharton's jelly or whatever they want to tell you, and that's like your only option, they're not the right one for you. Sometimes those are good options for people. I don't think using those things are always bad or not a good option, but if that's the only options they can give you, they just haven't been trained well enough in regenerative medicine to be able to use your own body, right? So I've used umbilical cells on patients where I'm not going to tap into their bone marrow or get fat from them, and that's the appropriate time. But again, if all they know is what they can buy, they probably haven't been well trained in injections or guidance or regenerative medicine. So that's a very low bar to just not use them, and use someone who's trained in the other ways of doing regenerative medicine. So where you can get, there's two types of stem cells you can get from your body. You can get them from your fat or adipose, and you can get them from your bone marrow. Both serve a purpose. I do both in my office. Some physicians choose one or the other, and I can't speak to why. And there's a little bit of a, it's still kind of up in the air if one is better than the other. There was some theories that bone marrow had the most potent and robust cells, but adipose has the most numbers of cells. And that still is kind of the argument between the two. So I use both 90% of the time when I can get fat and bone marrow from patient, because the fat does provide like literally a physical cushion if it's a knee. And it has the most stem cells, so why not use both? But again, that's very physician dependent. But if they're able to tap into your bone marrow or get your adipose, they've been very well trained. I mean, you have to do a whole host of courses essentially before you're even allowed to do that to a patient. So that's why I'm saying, like, they're well trained, because they don't just go to an overnight course and suddenly learn how to do those things and not know anything else about regenerative medicine. They've studied cell counts, they've had many mentors, they've had, learning about all of the different things. So it is, again, important that they at least can offer you use of your own cells. I agree, Dr. Nancy, that adipose provides amazing outcomes. I think they all do. I'm in this field of medicine because it works and it's spectacular. And I literally love when people come back to me and are like, I can do my sport again, or I have no pain, or I can pick up my grandkids. I mean, it's literally nothing makes me happier than patients telling me that their pain is decreased. And
I
it's so
basically
simple.
cried when I told the doctor who did mine that I was like able to snowboard again, because that was like my marker for myself, right? Like, it's this thing that brings me joy in my life, and like if I could do it again, I would consider myself healed. And it's like I've been snowboarding a lot this season, and it was it was just a very powerful moment for me.
Those are the things that are important in life, right? I mean, I think pain is a normal part of the human condition, but not, but when it affects your quality of life, like what else do you have, I mean, when your health is affected, like it's a downward spiral of mental health and physical health and other things kind of go down the drain. And so, it's super important. It's super important. And even though they're cash procedures, spending money on your health, there's nothing more important to spend money on. So I think people don't know about it because insurance doesn't cover it, but I get asked all the time, like, does this really work? And I'm like, I don't own a whole medical practice and just practice things that don't work. But so people think because insurance doesn't cover it, it doesn't work. When the reality is insurance does not care about your health at all. I've been a doctor long enough, even when I did take insurance, I used to do other procedures that worked for patients, and over the years they would somehow tell us that insurance no longer covered it because there's not good studies showing it worked. And I'm like, oh my gosh, like I literally have like cured people's headaches or helped them with their headaches, and now I can't do this procedure because you're not covering it. Like that, insurance companies do not care about your health, period. They only care about making money. They literally do not care about your health. So I say that because I do lots of things in my office that really change people's lives, and they're not covered by insurance, which is unfortunate. But I made a choice personally way back in the day that I'd rather impact someone's life and health. It was more important to me to impact someone's life and health than feed the beast of the insurance company. And that was actually a hard decision to make because I thought that I could affect more people if I took insurance, which I could, but it didn't align with my values of actually healing people. So I could be a slave to the insurance company, or I could impact fewer people's lives in a greater way. So I chose the latter. We all choose something different, but I don't know. The regenerative medicine, or specifically the orthopedic stem cells and platelet component is just super cool.
That's amazing. And
yeah.
I just wanted to, so there's two things I want to add. So I want to talk about like the different kinds of imaging a little bit, because ultrasound's super cool. And then there's a question for somebody that I want to answer. So when it comes to the imaging, it's like a lot of places will be like, oh yeah, we can do imaging. We're going to do an x-ray. An x-ray gives you very limited information, especially about any kind of soft tissue. It'll tell you about the joint space, but that's about it, right? Because you can't actually see the soft tissue on an x-ray. So then you can do an MRI, which is going to give you a snapshot of that soft tissue, but it's going to give you a really thorough, like kind of one where you can go through the whole area and really see where the damage is. And so that's very
soft
helpful.
Soft tissue being muscles, ligaments, tendons,
cartilage, all that stuff. Yeah. Yes, thank you. And so it's going to kind of give you like a more clear view of that. And so you can kind of figure out like where the damage is, where there's swelling, where there's fluid, all that kind of stuff. But it's a snapshot in time. The cool thing about ultrasound imaging is that you can actually like move the joint while you're imaging. And this is how they figured out like which ligaments of mine were loose and like which ones were okay. And you can like see the blood flow, like what's the blood flow to the area all in real time, like while you're looking at the screen and they're like moving your joint. So it's a really unique kind of imaging. And doing that with mine, we were able to figure out like the bone wasn't the only place I had damage, right? Like I tore the capsule of my knee. I tore the ligament going from my kneecap to my femur. And I tore like a little bit of the muscle attachment, and I damaged the bone and the cartilage. So we injected stuff into all of those areas. So it's like we didn't just work on my bone and cartilage. We worked on everything surrounding the area too. So one of the questions that popped up was, can this be used in recovery post-surgery situations, such as long-term abdominal discomfort and pain following a bilateral hernia surgery? So if you could answer that, and then maybe talk about like the other post-surgery stuff.
So let's see, specifically for hernia surgery, I mean, there's so much, I don't know where your hernia was. There's lots of different types of hernias, nor why you have pain. But I mean, the short answer is yes, you can do, so some orthopedic surgeons and some people will do PRP even intraoperatively. They won't do stem cells because that's a whole nother procedure. So sometimes you can ask your orthopedic surgeon to do PRP intraoperatively. There's zero way a general surgeon knows about PRP or stem cells, so which would be like an abdominal surgeon. There's so many reasons you can have post-op pain from abdominal surgery, so I don't even know how to answer that question other than if it's like the scar itself that's causing pain.
Well, this is when someone would come in for an intake and just talk to you about it, right?
Right. I mean, it's you know, there's value in seeing a physician in person because, you know, a physical exam is pretty important, like putting your hands on a patient and pressing on the belly or touching the scar. But to answer your question, yes, you can do these things post-op. I don't touch post-op patients for 6 to 8 weeks after because that's, you know, if it's just too many kind of cooks in the kitchen at some point. So if you had surgery and you weren't my patient, and you were having problems, you need to go back to the surgeon for a couple of months, because once you get more docs in and you get more people doing things, then you don't actually know what caused the problem. And sometimes surgery just takes a long time to heal from, longer than you would expect. So if you're my patient and then you have surgery and I'm communicating with your surgeon, and you know, I would do PRP or something afterwards. So I don't know if that answers your question, but it's, you know, it's honestly always a good thing. I mean, I had
worth checking out.
Worth checking out. But it just, you know, be cautious of giving yourself time to heal and wanting to do too many things at once. I mean, we live in a society and a culture of fast pace. You know, we check our email 20 times a day and we do things and we respond and we want to heal quick and we don't give ourselves time to rest. And the body is going to take its time to do what it wants. And so just to kind of jump the gun a little bit in things that are going to help you heal, or to, I mean, I'm not going to go into details, but eating a very healthy diet, no processed food, no sugar, or limited, you know, processed food is a big term, but, you know, really limiting your sugar intake, your alcohol intake, pro-inflammatory things. I mean, eating as many vegetables as possible is always a good idea, and making sure you're getting enough sleep. Sleep is where your physical and mental body literally heal and regenerate and rejuvenate and recover. So again, going back to, like, we live in this fast-paced society, you cannot speed up the healing process internally. So it's not going to happen as fast as you want, but if you give the body the nutrients it needs and the sleep it needs and the time it needs, it will heal mostly. So I'm kind of on a tangent here with that abdominal question. But
actually, I really like where you're going. So I'm going to speak more to like my own experience with like the food and the healing thing. But just before I move on to that, are there any other like post-op, and maybe not like acute post-op, but like years later, so like people who have had like, you know, meniscal reconstructions or surgeries or something in the past, or like a ligament reconstruction that just needs like a little extra TLC like a decade later?
So I was going to say that actually, and kind of in speaking to that, pre-op you can come do PRP or stem cells. I've had a few patients do that, because then you're putting all this, platelets stick around in the area you put them for approximately 7 days, and then the reaction continues to last for a few weeks after that. I mean, actually months after that, but the cells of the reaction stick around for a couple weeks, and then it dissipates over time. But so I say that because I've had a good handful of patients that like tear their ACL or partially tear their ACL or their meniscus, and they're already going to get surgery. Like, let's just take the trying to convince them not to get surgery off the table. But it's totally worth it to come to me even a day or two before surgery, have the injection so those healing factors are around, and then you have surgery, and it just enhances the healing process post-operatively. So if your surgeon isn't going to do it, I've had a few people do that, and I've had people do that who maybe had an ACL tear like years before and didn't do that. And then they came and they did PRP with me and they told me that their healing was better with PRP, which is interesting because a decade, you know, apart, you're older and you're going to heal slower. And they're healing faster and better and more robustly with PRP. So that's a very good kind of comparison. But post-op, I mean, yeah, I see post-op patients, again, not 6-8 weeks post-op, but years later, whatever, even, I mean, knee replacements, meniscal repairs, I mean, all of those things, you know, we can have a whole conversation about what I think about meniscal surgery, but but I mean, yes,
you can touch on it if you want.
No, I mean, but I see post-op patients or people who have had shoulder surgeries, knee surgeries, ankle surgeries all the time because either, you know, it's just like once you have one surgery, it's like maybe you had, again, to stick with the knee because most people understand the knee. I think maybe you started off with a meniscus repair and then they took some meniscus out and then maybe your ACL is a little torn and then, you know, so they're repairing your ACL. And at some point, like you lose the ability to keep repairing and then it becomes a replacement, right? So I've had people who've maybe had 2, 3, 4 surgeries and their pain is not getting better or it's even getting worse. And there's so many complications that can happen with that. And so then they come to me because they're like, I don't want an ankle replacement or an ankle fusion or a knee replacement or whatever the surgery may be. And we do stem cells. And that would be a case where stem cells are like going to be your best bet and not PRP. And they've never required that fusion or replacement or whatever. So you can always do injections. Again, like less is better, less is more. You can always do injections, you know, even, I mean, in a knee replacement, I'm generally, I will do PRP. I won't do stem cells in a knee replacement just because I think it would be a waste of someone's money. So really briefly, before we get on to like the diet that you're going to talk about, I had touched on when to do stem cells versus PRP, and that's very much up to your physician. My kind of like, there's a huge gray zone. I mean, if money were no object and you weren't afraid of the procedure and you had all the time in the world or whatever, stem cells almost 100% of the time because they're just 10 times as potent, period. However, that's not the case for most people. And so the times where you would do stem cells or where I'm more like pushy with like, really, you should do stem cells and not PRP are severe arthritis and labral tears. And then again, like multiple, if they've already had multiple surgeries and, you know, they're like, I'm trying to prevent a super severe surgery, it would be stem cells. PRP works pretty well or great for meniscus tears, rotator cuff tears.
Worked great on my wrist.
Yeah, mild arthritis, ligament strains, SI joint pain or sacroiliac pain. I'm trying to think of ankle, you know, everyone has sprained their ankle a bunch. Like thumb arthritis, wrist arthritis. So, I mean, PRP is my go-to because I think it's cost effective and
it's using all your body's own fluids. It's really cool.
Right. And it's less invasive than stem cells and all of those things. Yeah. So that's kind of my opinion on when to do one versus the other. And sometimes I do Prolo with PRP. Sometimes Prolo being the sugar solution because you can tighten ligaments and you can tighten ligaments with any of them, but you can just get more with, you know, that does come out of a bottle, so you can get a lot more solution and treat a bigger area.
I will say that's kind of what they did on my wrist. It was like they used like PRP to kind of stimulate healing in the area and like provide the building blocks, and then mixed it with a little bit of Prolo to kind of tighten the ligament back up because it was super loose.
Yeah, exactly. And so that has, I actually just saw a patient yesterday who came back with a different injury, but I had seen him years ago. I don't even know, 4, 5, 6 years ago. And he's like, he had separated the front of his shoulder. So it's called your AC joint. And I did just prolotherapy on him twice. And he came pretty acutely, like within a week of his injury, and his shoulder was moving a ton. And I think this is what he told me because I didn't remember, but he said that I injected him twice and his shoulder is totally fine. And he's like, I tell people all the time and they don't believe me and they go get surgery or they do all of the other things and just come see you. But he came back to me yesterday for something else. And that's awesome, right? Because when patients do better, you know, like they'll come back if they have another injury, which is what I want. I don't want to need to see my patients all the time. But then I didn't see him. And then, you know, I'm always like, oh, I hope that helped. Did it help? I don't know. Because you never get the like, just follow up and like, high five, it worked, you know, because if they're feeling good, they don't come back. So it's awesome when people come back with a different injury and they're like, you totally fixed my last one.
It's super cool. And, you know, as you're doctor shopping, I mean, I went to some of the, you know, top doctors in Denver who like specialize in knee stuff. And I was like, okay, like I'm going to go to the best if I'm going to go. And they were great, and they had wonderful bedside manner, and they were very kind. But they were basically like, yeah, if you ever want to be active again, this is your only option. And I was like, well, what about and this is before I did all my research, right? I was like, well, what about regenerative stuff? Like, what about stem cell? And they go, no, that won't work. Instead of, I don't know if that will work.
I have to give you an example of that. So again, I've been in this space for at least 10 to 12 years, something like that.
And so, I'll just say it worked.
Yeah, it worked. Right. So I used to work in another place before I opened my own business, and I would get together, and it was not an orthopedic practice, it was a pain management practice, and I would get together with all of the surgeons, and they would, and tell them that I was doing regenerative medicine, and they were like, it doesn't work. Like, literally, there's no studies that show it work. And I would argue with them. I'm like, show me a study that a lumbar fusion works. I really love arguing with orthopedic surgeons, by the way.
Didn't you had like a spinal specialty background at one point, right?
No, I mean, in rehab, we do a lot of like pain and spine stuff in general. So yes, I was doing spinal injections at this time in my life. And they were like, it doesn't work. There's no studies that show that PRP or stem cells work. And I'm arguing with them, and I was doing it. Anyways, that practice now has 3 physicians that only do regenerative medicine. So physicians, medical providers say it doesn't work when they don't understand it or they haven't heard of it. So honestly, we learned so much in medical school. Like, our brains are filled with more information than any other training I know of. So we're kind of brainwashed to think we know everything about medicine by the time we leave, which is obviously not true. But, I think a lot of physicians feel that because we didn't learn about it, therefore it's not like real medicine. And so, and that's unfortunate. It is unfortunate. And I even have a hard time with some things that I still can't wrap my head around, like energy medicine and stuff. I'm taking my 7-year-old to like an energy healer for his allergies, because I'm not interested at 7-year-old to do allergy shots, right? And I'm like, this just seems weird to me, but I'm going to trust the process. But, again, that's I'm open-minded to it. But anyways, back to like physicians, I think as a whole, because they don't understand it or haven't heard of it, say it doesn't work. So, and that's unfortunate.
Yep. I love it. Well, and the energy healing stuff, that is more of kind of a new thought for people. But and then for myself, it's like I actually kind of use various forms of that in my practice now. And for those who know me, I was in academia for years. I wrote research articles. I was super left-brained. I was in the sciences. Like,
you still are super left-brained.
I am. But I'm becoming like more of a blend now, right? And going to chiropractic school was a interesting choice for me, because it's totally not what I expected at all. I thought I was gonna either be in like hardcore like stem cell research, like in a lab, or going to medical school or something. And then I ended up more in the natural healing realm, and just saw this whole other world of medicine that or healthcare, or whatever you want to call it, that people just barely know about because it's not like mainstream and conventional. And I worked in this amazing office with it was like a chiropractor, an acupuncturist, massage therapist, kinesiologist, craniosacral therapist, and they all did like functional medicine and nutrition. And my mind was blown. Oh yeah, and we had a psychologist in there, and they all worked together. And my mind was blown, and I was like, this is what healthcare should be, is like all these people working as a team from all these different angles, because we all have our own values, right? Like, conventional medicine absolutely has its value, but
that's what I think all practitioners, and this makes me, I was talking to a patient of mine, because I, am Western medicine trained, and I have done a lot of extra education in the functional medicine space and regenerative medicine space and things like that. And so people come to see me for the regenerative medicine stuff, but also because, if they have, I don't know, high blood pressure, I could prescribe them a medication, and or I could recommend a supplement. And truly, for high blood pressure, it depends on how high it is, what I'm going to do. But I see patients who are like, I'm so anti-medications. And I'm like, well, they serve a purpose sometimes. That's not my go-to. Again, least invasive or least harmful, but sometimes you do need a medication, and that's also okay.
Yep.
And I wish that more physicians would be open-minded to other treatments. But the other side of that is, I've had patients, I kid you not, die because other practitioners who are not physicians think that they know, like, I had a patient with vaginal bleeding, and she was postmenopausal. So and I was like, pretty much you start bleeding vaginally after menopause, and and you're not on hormones, like, you probably have uterine cancer. But this person who
needs to be checked out properly
was a doctor of some sort that I'm not going to say, but they were a doctor, we're like, oh no, you're fine. I'm going to give you these herbs and whatever and treat you that way. And so my patient, and I told her, like, this is not okay. You need to do X, Y, and Z. And she didn't want to because she only believed in supplements, and she was seeing a doctor. And I mean, literally, she died 2 months later. And so both sides need to know their limitations. And because there are a lot of people who call themselves doctors who are not physicians, patients need to know who they're seeing as well. You know what I mean? Like, they need to know if they're seeing a medical doctor, a naturopath, a chiropractor, a nurse practitioner. I mean, we all have very different training. And so it's just important to know that. And again, we all need to know our limitations.
Yes.
And where we excel. And there's just this, like, again, this gray zone of so much of it.
So like for example, like to what she was just speaking to, like in chiropractic school, we get basically just as much pathology training, but it's not so that we can treat it per se. It's more so that we can refer properly. And then as I go into like functional medicine, that's where we get more training. And this is like hundreds to thousands of hours outside of schooling.
Oh, yeah.
So this is a ton of continuing education, and functional medicine is also continuing education for medical doctors. It's not necessarily something that they get in school. So functional medicine is, and you can correct me if I'm off, but to my understanding, like that's functional medicine is a whole bunch of continuing education. But so, for example, when we come back to like the regenerative medicine side of things and recovery, this is where other fields can be really, really helpful. So one of the beauties of chiropractic care is hands-on care. Like chiropractic actually means done by hand. And there is something incredible about touch when it comes to healing. And if you have scars or you have an injury, like even just touching yourself and massaging yourself can incredibly benefit that. And that's where chiropractic care comes in on a number of levels. One, we have touch, and like we work with the tissues and we work on kind of helping the rebuilding phase of the tissues so that the tissues rebuild in the right structure. And that's what PT does too, right? And it's like PT has, and I'll touch on that in a second. And then I know we're coming up on the hour. Dr. Quinn, are you available for a couple extra minutes? I know you have a busy schedule.
Yes, I do have a 10 o'clock patient, but let's do this. Let's talk about cool. PT and the diet part.
All right. Well, and if you have to hop off, you can go see your patient, and then I can kind of finish up talking about the diet part, and I'll make sure to send this to you afterwards. Okay. So you do whatever you need to do, but as long as you can stay, awesome. So when it comes to chiropractic care, it's like, one, I can work on all of the tissues and stuff, but two, chiropractic care very much is about balancing your nervous system. A lot of people always think of it as like just like cracking things, and it's so much more than that. And it's like when we balance the nervous system, that's also like an energetic component of your body. So it's like it's engaging your body's natural healing process and recalibrating the body so that it goes into a regenerative and healing state. So that is why I think it's really important to make sure to get follow-up care while you're healing. And you can do that. Chiropractic is amazing at that. But then I'm a chiropractor and I got my care, but I also saw a PT and he was amazing. And it's like, you can have your PTs that are like, here, do this exercise and then do it at home and then do it in front of me and then do it at home. That's kind of like your basic PT. The PT that I went to, not only did he give me all these different exercises, which he'd like, when I came in, he'd be like, what are you feeling today? What do you need? And he'd ask me, and not just like, so he would change the care based on what was going. What was that?
Who'd you go to?
I went to Alex Ashworth at Resolute Physical Therapy. I highly recommend him. He's awesome. He's in Arvada.
Oh, he's in Arvada. Yes. Will you text me his info?
Oh, yes, absolutely. He's wonderful. And then he also works with a lot of my CrossFit patients too, which is awesome. But we also did a ton of dry needling, and you got to be kind of careful about who you get dry needling from. I'm actually in the process of getting certified through him because I think it was so helpful to me. I wanted to learn how to do it. And they do a kind of a more thorough dry needling training, and it's really cool. But dry needling can like stimulate healing of the bones. You can actually like literally go in and like peck at the bone and like stimulate the bone to heal around like a ligament tear or a tendon tear. And then it also kind of recalibrates the kind of just like the signal in the muscle, and then they'll kind of connect e-stim to it, and we did that. He also did scraping, so like we went through and we broke up scar tissue. And I originally injured my knee when I was 17, and I think I had scar tissue in there that no one ever really addressed, which is probably why I was more prone to a knee injury again. And so he went up and broke up all that stuff from when I was 17. And then we also did like We basically used, it's kind of like a constrictive band around the thigh while you exercise, which pushes blood flow down into the area to heal it better. And we did that. And then I saw him like twice a week for 8 months, and this was covered by insurance, right? So
That's
this
awesome.
is where I,
That's a long time. But that's
yes, I chose to do that. I was,
yeah.
definitely able to be released sooner, but I was like, no, like I've done this like four
Yes.
times now. Like I just want this to be done. And so
Totally.
I think doing that was really beneficial. And then I went to like once a week, and then I stopped when things were no longer covered. But it was so worthwhile, and I'm so grateful that I did that. The other major thing that she was kind of touching on when it comes to diet and stuff, one of the most important things you can do for your healing before, during, and after is eat the right foods, because and there's this weird thing that happens when you get injured where it affects your brain and your neurotransmitters. And I actually did a whole like hour-long talk about how stress affects the body, that you can check out on, I think I have it on my other channel. I'll be transferring it over to here. But and my other channel's Depth Wellness, if you ever want to check that out. But I'm going to be kind of transferring stuff to this one. But we did a whole thing about how stress affects the body. And it's basically like when your stress pathway is on, it steals the building blocks for your neurotransmitters, which is why when you get injured, you can really easily get depressed. And it's not really your fault. And no one really talks about this. And when I was depressed, it was like holidays. I was like, I just want to participate in Christmas and eat all the cheese. And I ate all the cheese. And my body already was a little sensitive to cheese, but then I ended up developing like a kind of intense food sensitivity to cheese because I ate it during a time when my body was really inflamed. And when you're injured, when you're healing, it also kind of stimulates leaky gut, if you've ever heard of that, which is where basically food particles can leak through and then you accidentally develop a kind of oversensitivity to them. So this is why it's like super important to avoid foods that your body might already be sensitive to that aren't ideal, which is basically going to be like dairy, grains, alcohol, sugar, and then really focus on your healing foods, which is going to be like healthy, organic, grass-fed, not pesticide, antibiotic full proteins, and good things with healthy fats like fatty fish, and preferably wild caught over farm raised, and focusing on things like chicken, which has a lot of lysine, which is incredibly helpful for healing your ligaments and healing your cartilage and getting the right amino acids. And then focusing a lot on vegetables and things with antioxidants. So like blueberries are incredibly helpful for stimulating stem cell growth and all that stuff if you end up working with stem cells. And then I was also on a pretty good supplement regimen during this time, which, provided my body with antioxidants and things to kind of, antioxidants you can think of as like the janitors of the body, right? So they go clean stuff up.
Honestly, for diet, I mean, yes, all of those things are wonderful. The key to health is to make it your habit, period.
Yeah.
Yep. Just doing it before you're going to get surgery or after surgery or being more proactive. We all have to live life. I fully think like if you drink alcohol, have a drink sometimes. Don't be an alcoholic. I mean, that's easy to say,
I believe
right?
Daniel Amen says the brain healthy amount of alcohol is 2 or less a week.
Okay. Yeah. I mean, if you're going to, I don't know, eat poorly, do that. Like you have to be really good 90% of the time and pretty good 90 or that extra 8% of the time, and only about 1 or 2% of the time can you just suck at what you eat. And that's just like your diet needs to be your job. I mean, your health needs to be your job, right? So as important it is to wake up and get dressed and go to work and then do your job and come home, like you need to dedicate that importance to, or you should be dedicating that importance to health. Like health is not guaranteed, and so being an active participant in your health is super important. And so the healthier you are at baseline from anything, you get injured because, I mean, you get injured and suddenly you're not going to cook all these amazing meals. That's just not going to happen. Let's be real. But if you are already healthy at baseline and you get injured, A, you're going to heal better and faster. B, even if you are a couch potato because you have to be, it's more okay because you've been eating healthy and hopefully exercising. And then again, the recovery. I mean, your body is at just a healthier. I mean, see this all the time in people. I mean, if just
it gives
your
you like
baseline level of
health reserve to work with.
It is. I mean, it really does. And so I don't know. I agree with you on the food things, but I think maybe people hearing this, it's like they're not going to just start cooking amazing meals if they're not in the habit of doing it.
And the reason that I speak to this, and that I'll probably do like another live on at some point, is because with getting injured and then, you know, having a diet or something that's not ideal and not having that health reserve, it can make you susceptible to having kind of inflammatory conditions, which can be, you know, things leading to weird autoimmune things. And that's
which we see all the time. People saying
yes.
like, I've never been the same since whatever. And you're kind of
Mm-hmm.
like, I don't know, that was like how does like your knee injury relate to your gut health? But it does. And I mean, you know, we can't parent exactly, but there is something when people say I've never been the same since fill in the blank. And there are greater reasons to that than, you know, we can quantify.
Absolutely. Well, I know you have a patient, so if people are interested in that whole like injury autoimmune connection, that's kind of more my niche, and I'll probably speak to that later in another live. But Dr. Quinn, thank you so much for taking time this morning to talk about this stuff, and I really hope that this can get out. So to everyone on here, like please like share this with people. The whole reason I did this is so that people can learn about what regenerative medicine is and that it's even an option, because a lot of people don't know it's an option.
Yeah,
So,
I think real quick, just like in summary, because you know people are probably not going to listen to the whole thing. I mean, the important things to know is that regenerative medicine is out there, and it's typically not covered by insurance, but it's still worth it for your health. Your health is always worth it. Find most likely a physician who's doing regenerative medicine. Make sure that whoever is doing the treatment can offer you your own cells. Even if they don't end up using them, that is an option. So they're called autologous, being your own, and that they're using imaging guidance. I mean, those are kind of the three biggest things to look out for. And then from there, you know, you have to obviously personally be a good match. But I'm glad you guys learned new things, and thank you for listening.
Absolutely. And so if people want to get in touch with you, what's the best way?
So I'm in Golden, Colorado. I do see patients that come to me from outside of the state. My practice is Core Medicine. It's Kore Medicine. You can find me online, obviously on Instagram here. And I do telemedicine visits, but generally I'd like to see you in person. I may or may not get imaging or look at your own imaging. You can also call 720-605-WELL is our number. Yeah, and I love what I do. I'm happy to help, and I would never recommend a treatment that I don't think is appropriate. So,
and if anyone wants to learn more from her, she is also releasing a book. So,
oh yes, the book is called The Gap. I only wrote one chapter in the book, but yes.
So it's called The Gap: Simple Steps to Reclaim Your Health and Reverse Most Chronic Diseases, and it is now available on Amazon and Kindle. So check out the book.
Perfect. And I'll put a link to that on my bio as well. So
awesome.
Thank you.
Well, thank you, and have a good time with your patient.
Thank you. Will do.
All right. Bye.
Bye.